This module is going to be going over the health and wellness for the EMS provider. The World Health Organization defines wellness as a complete state of physical, mental, and social well-being, and not just not having a disease or being ill. So there are several different things that we classify that help contribute towards your overall health, and they consider these to be health behaviors. They all kind of go together in different ways, and they vary person to person based on complex set of genetics and life choices. So first one, most obvious one perhaps, is genetics. If your grandfather dies at 65 of a heart attack, and your great-grandfather died at 65 of a heart attack, and your father died of a heart attack at 65, there's a fairly decent chance that you, in fact, may die around 65 with heart problems. On the other hand, if everybody in your family lives to be 102, decent chance you may live to be on into the triple digits. Environment is another thing that really comes into play. What environment are you raised? Are you raised to eat healthy kale and yogurt and other things that are good for you? Or are you raised on McDonald's and Burger King and other things that are admittedly not the best for you? And the other thing there is that kind of plays into environment a little bit, but cultural beliefs, what you believe in, whether you seek out medical care or not. There are some cultural or religious beliefs. They don't believe in modern medicine. So they don't choose to vaccinate their children. They don't seek medical care if they are ill or sick. So, that obviously is going to affect life expectancy as well. Level of education. There have been studies that have shown the higher the level of education, typically the better the overall health that the person has. Socioeconomic status is another big factor in here. It's hard to make it through a cold winter if you can't afford a jacket, if you can't afford adequate clothing, or if you can't afford air conditioning. There are people who have heat strokes in areas where they can't afford to run air conditioning. So, a lot of this stuff, what you can or can't afford, if you can afford adequate nutrition and clothing and other what we consider to be creature comforts, but for some people may be, some might be a necessity, some might be a luxury. Weight is another thing. Obviously weight does play a factor in overall health. Too much weight is not healthy for the patient. Too little weight is not healthy for the patient. And then tobacco use, as well as other substance abuse in general, all of these substances will end up having a detrimental effect, usually affecting blood pressure, heart rate, things of that nature. For your components of wellness, the World Health Organization says, wellness is not just not being sick. So they actually break down the areas of wellness that kind of almost go along with your Maslow hierarchy of needs, but break it down into parts that you need to have well. So emotional. Your emotional health is really important. You've got to be able to function in life, and if your emotional health is not there, you're going to have a harder time dealing with other aspects of life. Social. Now, some people are very social. They're social butterflies. They go out and they need to see people. Other people are much more solitary, and they may prefer to have alone time. But whichever way they may swing, they need to have their social needs meet. For your spiritual, whether you believe in Buddha or God or anybody or nothing, the spiritual needs must be met, or a lack of spiritual needs. Occupational. If you are miserable in your job, it's going to have a detrimental effect in your overall wellness. If you hate your job, you're going to be miserable, you're going to be stressed, it's not going to be pleasant, and it will actually physically affect your body as well. On the other hand, if you really enjoy your job, that will add to your overall sense of wellness. Intellectual health for me is very important. I like to learn stuff. I'm very curious. Some people aren't as curious, but you need to have your needs met. Your physical. Obviously physical is probably what most people think of when they think of wellness, but physical wellness is important as well. If you can't get up and perform the activities of daily living, if you can't dress yourself, if you're having difficulty tying your shoes, that's going to play into your overall wellness and what you're able to do. And then environmental. Even if all the rest of it is there, if you don't have the security, if you don't have a place to go home at night, if you don't have heating in the cold. It's cold outside right now. If you don't have heating, then you're going to have problems in the summertime if you don't have air conditioner or a way to cool off. So all of these things all interrelate to the overall sense of wellness and completeness of wellness. The Maslow's hierarchy of needs, what this says is that your basic level needs have to be fulfilled before you can go any further. So at the bottom of this pyramid is going to be your physiological needs. So this is your food. Do you have enough food? Do you have enough water? Until you have your basic necessities for life, you're not going to be able to have the rest of the stuff there. Your safety needs. Once you have all your physiological needs met, are you safe? You may have enough food and water, but if you are not in a safe place, you will not be able to have overall sense of well-being and health. Once the safety needs are met, then we look at social needs. Animals are, for the most part, social creatures, whether it's purely for reproduction or whether it's for socialization. And most humans are social, so we do need to have those needs met as well. And then esteem is more self-esteem, but once again, if we don't have the socialization needed, if we don't have our safety needs met, if we don't have our basic food and water met, our self-esteem is never going to get to where it needs to be. And then, of course, the highest of the pyramid is going to be your self-actualization, where you have all of your needs met. So stress response in the body is predictable to a degree, and it's a response to your body to any demand, and your body does not necessarily differentiate between good stress or bad stress. It just recognizes stress. So stress is actually not bad when it's in the appropriate ways or the appropriate amounts. So a demand or a stressor is anything or any stimulus that produces this stress response in the body. And like I said, your body can't really tell the difference if it is a bear trying to eat you or if it's the test that you're about to take. It just knows that there's stress, and so it's going to react the same way to either one of those. So this chart here that you can see, you've got low stress, low performance. So your performance here is on the left, low, medium, high. And then your arousal level, what degree of stress are you under? And if you notice, there's a nice bell curve there. And so what this shows is low stress, low performance level, fairly inactive, not a lot's going to happen. But as that stress level goes up, your performance level also goes up to a certain point. So medium stress level leads to the highest physical performance. But then if you go past that kind of tipping point, the stress level, instead of increasing your performance, actually decreases your performance fairly quickly, leads to anxiety, panic, anger, violence, where you can't make a rational thought or decision at that point. So with our stress hormones, the two that we are most concerned with are going to be your epinephrine and cortisol. You may have heard some stuff about cortisol before, like commercials talking about long-term stress response, stress hormones and stuff, and it can lead to weight gain and increased body fat over time. But the more immediate effects of what we're looking at here is epinephrine. So increased heart rate, strength and contraction. To a degree, that's good. We want our heart rate to increase so that we can pump more blood to fuel the skeletal muscles so that we can run away from whatever it is that's trying to harm us, or we can fight whatever it is that's trying to harm us. The pupils will dilate so that you can see whatever it is that's trying to harm you. Increased blood glucose level and breakdown of fat, so we have more fuel sources readily available. Your blood vessels will actually divert away somewhat from the skin and the digestive tract. The reason for this, if a bear is about to eat you, you don't need to go to the bathroom. You need to make it through the next couple of minutes instead. With this redirection of blood flow and increased blood flow, it will cause a slight increase in blood pressure. Your respiratory rate increases to increase the rate of or amount of oxygen you're bringing in. Your airways increase in size, once again trying to get in more oxygen. And the nausea, vomiting, tremors, those come from the shunting away of the blood vessels in the skin digestive tract. So all of these things within reason are good, but if they are too much, or if there's too much present, then it actually will lead to the more negative side effects. So with this, the negative side effects, what we look at is called general adaptation syndrome. So you've got your baseline, and that's just your normal everyday. So alarm is when something happens to make you go, oh, hey, something's after me, whether it's I've got a test and I forgot to study, or hey, there's a bear trying to eat my face off. Something causes a stress response in your body. your body recognizes it and releases these stress hormones. Okay, your body gets kind of used to operating within these stress hormones. That's your resistance phase. And then exhaustion is where you have run out of these stress hormones and your body can no longer cope. And so this leads you to the rest and recovery phase of your adaptation syndrome. You have a couple of different types of stress reactions. You will see a wide variety of them. Acute stress reaction versus cumulative. Acute meaning, this is something that's happened here and now, right now. Cumulative may have a lot of little stress factors along the way that add up to something big. This is where you see people kind of freak out or spaz out about what seems fairly innocuous, fairly inconsequential, and they just have a conniption fit about it. But it's not that they're freaking out about, it's all the little things along the way that got them there. Burnout is another type of stress reaction, usually more long-term than short-term. And then post-traumatic stress disorder is a classified syndrome. This can happen hours, years, days, minutes, hours, years later after the actual incident or collection of incidences. So your signs and symptoms of your cumulative stress and your burnout. Okay, your physical are going to be fatigue, headaches, GI upsets, and maybe increase or decrease in frequency, constipation, diarrhea, changes in appetite, both increased and decreased, joint muscle aches. For your cognitive, tends to lead to poor memory and concentration, and difficulty in making decisions, almost like you're overwhelmed with the thought of making a decision, so you just don't make one at all. The emotional side effects here, anxiety, which is fairly common, boredom, apathy, just not caring at all, and those can, especially apathy, can lead to emotional exhaustion where you just feel like you have nothing left to give. That can lead to your feelings of guilt, depression, and in severe cases can even lead to your suicidal thoughts or actions. And then kind of leading into the behavioral, irritability, increased smoking or alcohol, changes in your food, withdrawal or avoidance of other people, or just things in general that you used to enjoy, as well as increased risk for substance abuse. Now, compared to that, you do have a lot of similar signs and symptoms in your delayed stress reaction and post-traumatic stress disorder. In reality, they're about identical there. The big thing is just how we got to those points. Like what caused it? Is this a delayed thing? Is this one specific incident that's caused this? Or is this over time, lots of little things and not just one big incident that caused it? Some specific EMS stressors, and I like to kind of talk about these before you get out there, or if you're already out there, you probably are very familiar with them, because a lot of people don't like to talk about this. They don't realize that there are a lot of stressors in EMS, which you'd think they would, but they don't. So some of the things you'll see, encounters, work hours. Some people work 12-hour shifts, some work 24. I've even seen some agencies that work 48 on, 96 off. So varying work hours that don't always line up with our natural circadian rhythm, that can be very difficult. Workload, it's not unusual to make high volume calls. You may run, if you're on a 12-hour shift, you may make 12 calls in that 12-hour shift, or you may make 15 calls in that 12-hour shift, and that can be pretty stressing and taxing as well. And then of course pay. I think we can all agree that EMS is not ever going to get you rich. So pay can be stressful too. A lot of people have second jobs or part-time jobs that they work in their off time to make extra money. Conflict with coworkers and supervisors. A lot of EMS are type A personalities, very forceful and abundant with their personality and opinions. So that can lead to conflicts with people, and when you are stuck in close quarters with people for long periods of time, that can lead to some disagreements occasionally. Failure for other drivers to respond to your lights and sirens. That one got me a lot when I was younger. It was like, why don't you see me? Why aren't you getting out of my way? You have to realize that, give them time to get out of your way. But that can be very stressful when you know what you're going to is a true emergency and they don't seem to care. It's not their emergency. Having very difficult or confrontational patients, we're here to try to help you and you're treating me like crap. What's fair about that? So that can be very stressful. fear of making decisions or making mistakes. There's a lot of responsibility that lies on the EMS provider's shoulders. And, and nowadays, especially nowadays, if you do make a mistake, it's probably on camera somewhere, and there's a good chance you may get sued for it. So that kind of stress can be a little bit overwhelming at times as well. Any call involving dead or dying patients, to me, it's not so much dealing with the dead patients as dealing with the dead patient's family that's kind of stressful, but it is innately stressful because that's not something humans are designed to deal with day in and day out. Calls with abuse or neglect, especially those calls involving children with abuse and neglect, can be very, very difficult to deal with and can bring about some pretty strong emotions, both anger, upset, despair, sadness, and it's very tough to maintain control of those emotions and work through it and still be able to make those decisions and try to take care of that patient. So for your stress coping mechanisms, everybody has different things. I was always kind of taught, have your little shoe boxes, and when you have a bad call, work it through it, talk about it, but then once it's done, put it in the shoebox, proverbial, and then put it up on the shelf. And you've dealt with it, now put it away. Don't keep rehashing it and revisiting it every day, because then it's going to stay with you for longer. So everybody has different things. My big thing has always been find something else that you like that's not an EMS. Whether it's fishing, I like to fish, I like to play video games. We have a little mini arcade in our basement. Whatever works for you to de-stress, find something that's safe and legal, and have that be your stress release. Make sure that you don't get so consumed with the job that that's all you know. So there's several different types, and they classify them as short-term, intermediate, and mature mechanisms, or long-term mechanisms for dealing with this crap. Because at some point you're going to have crap that you have to deal with. And you can either deal with it appropriately and make it through, or you can short-term deal with it and have it affect you potentially forever and affect every part of your future, whether your loved ones, your career, or whatever. So your short-term, not as useful, denial, just flat out, it's not happening, it didn't happen, ignoring it. All right, acting out, so this is like the anger or avoidance, okay? You just kind of go on that primal instinct there. And then trivializing it. Oh, it's not a big deal. Now, it says inappropriate humor. There's some very appropriate humor that you will come across with EMS, but there also is inappropriate and inappropriately timed humor. So yes, there may be some humor to be found in some pretty bad situations, but don't trivialize it. Don't make it out like, oh, it's no big deal. It's okay for something to be a big deal. Your intermediate mechanisms are going to get you there short term, but still aren't good. Long term, they're still going to lead to your stress reaction. They're still going to lead to that cumulative stress that are going to help burn you out. So displacement, this is putting that anger on a safe target rather than the problem. But you find a safe target, so to speak, on somebody that you can get mad at that you know is not going anywhere versus what you're actually angry or upset with. All right, intellectualization. So this is kind of taking your feelings out of it and being like, well, it is what it is, in kind of looking at them as just the patients rather than the person. And then I actually am guilty of doing this one. I try to look at it from a scientific standpoint, and that to me helps the humanity part of it. If I think of them as kind of a collection or sign of symptoms sometimes versus a real person with real feelings and real thoughts. Reaction formation, when you feel something, like a call bothers you and you realize it bothers you and you suppress it and you're like, nope, I don't feel bad, I'm good, it's okay. Instead of recognizing that emotion and dealing with that emotion appropriately. Workaholism or escapism, just avoidance, doing excessive things, working nonstop or studying nonstop or doing other things instead of dealing with whatever the problem is. Okay, so your more mature or long-lasting mechanisms is suppression, which I'm not fond of the term, but basically choosing to put bad thoughts and feelings aside until there's a better time to deal with it. So it's not that you're not dealing with it at all, but you're just choosing a better, more appropriate time to deal with it. Distraction, redirecting your current focus until you can get to a point where you can deal with it. Now, one thing that's near and dear to my heart is EMS mental health. When I first began in EMS, there was very much, and there still to this day, is very much this kind of thought process of put on your big girl panties and deal with it. And that drives me insane, because we as EMS providers deal with a lot of things that most normal people would not be able, absolutely would not be able to deal with and should not have to deal with. But we're expected to do it, and then we're expected to do the paperwork and move on to the next call and just be okay. And sometimes it's okay not to be okay. But there's always been a stigma, it seems, of seeking out mental health because, oh, well, you're unstable, you can't take care of other people. And that leads to high risk of suicides and mental illness in EMS in general, which just drives me insane. It shouldn't be that way. So I actually went and did some research here and dug into some research papers that I found with suicide statistics. So on the left there, your figure 1, this is the comparison of EMS providers versus the general population for people who had contemplated suicide. So, anonymous study, 37% of EMS responders had contemplated suicide at some point. Only 3.7% of the general population had contemplated. That is astronomical. That's crazy how many more EMS providers have considered suicide versus the general population. And then if you want something even worse to me, is figure 2 is a comparison of people who actually attempted in some form suicide compared to the general population. So 6.6% of EMS respondents had attempted some form of suicide versus 0.5% for the general population. And to me, 1 is one too many. And I really want people to start going towards a sense of acceptance and sense of compassion and maturity to where how can we help you instead of suck it up and deal with it. So a couple of things I found collected, seen over on the website and talking to different people, but some really good resources for people in EMS. Reviving Responders is a great website. Code Green Campaign is another great website. Safe Call Now is probably one of the best ones I think out there, and the great thing about this, it's a crisis referral line, 24/7, 7 days a week, 365, occasionally 366 days a year. You can call and talk to somebody and get some help, and it's staffed by public safety people, and it's for public safety people. So, you know, one of the things I've heard before is, oh, well, you know, the psychologists, they don't know, they don't understand, they haven't been there. These people have. These people understand what you're going through, where you've been. They may not have been through that exact call, but they understand where you're coming from, and that can make a big difference, in my opinion. Then, of course, there you've got your suicide prevention hotline, and then a crisis line for information, help, and some places to turn to get some help if you do need it. So if you do ever find yourself in the position of considering suicide, thinking about suicide, or even just contemplating it, please take the time, reach out to them, get some help.